Brought to you by Covered California.
Well, the holidays are here, and that means holiday parties. Tonight, simple steps you can take to look your very best for any occasion. Dr. William Groff is here now with more on options for every age. Thank you for being here.
You're welcome. Good to see you, Kathleen.
Thank you. Well, everybody wants to have that glow, but during the hectic holidays, that's kind of tough. But you say you have some secret recipes, and they kind of vary with age. What are some of the things that people in their 20s should be doing to tune up?
Well, Kathleen, think back to when we were in our 20s. What was the most frequent problem that would pop up and kind of ruin a party for us?
I'll guess acne.
Exactly. Yeah. So, yeah. How frustrating is that? You're ready for a big night out, and you get this big pimple on your face. So we have this magic potion that we can use. It's actually what's used on a lot of the actresses and actors in Hollywood when they have a scene or something. They have to look their best. It's a medication called triamcinolone. And we can inject that into a pimple, and it will literally flatten it out within less than 24 hours. And it makes a huge difference in the appearance of those acne lesions. So it's a great treatment, something we can do for our patients.
Boy, that's remarkable with almost instantaneous results. Well, people in their 30s have different challenges, including brown spots, and some of those fine lines start to kick in. What can you do to combat that?
Right. Well, let's start with the wrinkling first. Certainly in the 30s, you start seeing wrinkling around the eyes, the forehead, in between the brows. And for parties and so forth, if we use a little bit of Botox in those wrinkles, we can have you party ready within just a couple of days. I mean, those lines start to soften within 24 hours, and certainly within a few days, you can see anywhere from a 50 to a 90% reduction in those lines in those areas.
Now, you say people in their 40s have loss of volume. I'm assuming that means that in that age range, you start to lose some of the fullness in your face?
Yes, you do. And what happens, especially in the cheek area, the cheek tends to almost split in half, and you get this depression or groove through the center of the cheek. So just a little bit of volume in that cheek makes you look more youthful. The cheeks look round and kind of like they did when you were in your 20s. So we like to use a product called Voluma. It tends to look the most natural, and it can last up to 2 years, which is really remarkable.
And all of these treatments, I'm assuming, are office visits, and you're ready to go within 24 hours?
Yeah, 24 hours and you're good to go.
So in your 50s, sagging skin and wrinkles, it doesn't sound pretty, but it is inevitable to some degree. But there are things that we can even do in that age bracket to improve our skin?
Absolutely, certainly. I mean, everything we discussed so far we can do for patients 50 or older. Now, with more intense lines or wrinkles, we need a few more days of, we'll say, downtime to be party ready, but we can certainly use lasers and resurfacing procedures to help with lines and wrinkles and brown spots and all those things. And they actually help tighten up the skin, too.
So maybe kind of a gift card prior to the holidays.
I think that'd be a great call. Yeah, why not?
To spruce up. All right. We could all use a buff and shine every now and then.
That's
Dr.
right,
Groff,
absolutely.
thank you so much.
Great seeing you.